Hi everyone, welcome to Raw Physiotherapy. I'm Jack. Today I thought we'd do a little talk about some knee pain. Knee pain is a really common experience and will happen to a lot of people throughout their lives. There's a number of reasons for this. There can be some overuse or insidious onset knee pain. It can be juvenile disorders such as Osgood-Schlatter's, so if you're a little bit younger. But there can also be traumatic injuries such as your ACL, your PCL and your meniscus. What I'd like to focus in on today is more specifically patellofemoral pain syndrome, which affects about 15% of people, more women than men, and it affects the soft tissues around the kneecap at the front of the knee here. The primary symptom of patellofemoral pain syndrome is a diffuse achiness at the front of the knee, as well as pain when you're kind of bending, squatting, going upstairs, and sometimes when you're sitting for long periods of time as well. Treatment really depends on why you got your knee pain in the first place. Sometimes it's a case of just some simple overloading and doing too much in the gym or taking up running and things like that. Other times it's because of poor movement quality or because of weakness somewhere along the kinetic chain. A recent review of the evidence looked at patellofemoral pain syndrome and strengthening and found that hip and quad strengthening can be really effective in the treatment of patellofemoral pain syndrome. So what can physio do for you? Looking at things like taping, your hands-on techniques such as dry needling, massage if you've got some tight or sore muscles, as well as movement retraining can be really important. Overall though, you've got to look at getting strong and having the right endurance and of both your quads and your hip muscles. If you've been suffering knee pain, it's limiting your lifting and it's stopping you from getting around day to day, get in touch with Raw Physiotherapy today and we can start putting together your individualised treatment program today.